When I started practicing, little I knew about the role of Sarcodes in homeopathy. And many endocrinal cases, especially of thyroid disorders or endocrinal problems, at some point they used to just come to a standstill. The results were very patchy. I never understood that why this was happening. We tried the best indicated remedy, we changed the potency, we even tried the anti-miasmatic remedies. But there was one eye-opener of a case when I was taking a case of a female who had a long-term amenorrhea. And this amenorrhea, I guess she had since last 2 to 3 years. She used to get her menses only after a few months, maybe 6 months, 8 months or so. So the assistant had already taken the case. I looked up the case paper. There was some indicated remedy. When I started asking few questions, this female who looked quite smaller for her age, was answering only monosyllables. In the sense, just yes, no, these are my aversions. So only fixed type of answers, which was not something appropriate for her age. Even if I asked her about her emotions, she said, if I ask her, tell me about anger, she said, I do get angry. On what? She did not have anything to answer. So a lot of things seemed to be not fitting to the kind of patient that I was talking to. I rolled up the pages to see, and then I suddenly found that this girl is 23 years old. And factually, she just looked maybe just 13, 14, 15 years old. I hurriedly asked her age and she said, it's 23. Something had just stopped growing at that time. That's what I got a sense of. I talked to her mother and she said that everything was okay till the time she achieved her puberty. The moment she achieved her puberty, something changed. She started becoming dull, getting dull in her studies. She couldn't answer questions properly. In fact, she flunked in her 8th standard. We put private tuitions and somehow we managed to get her out of her 10th standard. Things which was very much easy for her started becoming difficult. So a kind of lack of intellect prevailed. And that is the time her menstruations started, but they were irregular since the time it started. The physical growth had also stopped. Ideally, I would have thought of pulsatilla for her mild nature, answering monosyllables or whatever, or not well since menarche. But this was not pulsatilla. Why? Because there was something that was growing till a particular age that had stopped growing. Her physical development had got stunted. This was not Barata carb even, because Barata carb is about a global development. It is not about just a stunted growth. There is nothing endocrinal about it at that moment when a particular thing stops growing at a certain age. It starts and the development continues to be normal for some time and then it suddenly stops. So that means there was something to do with the hormones. That is the time I started looking up to Sarcodes. When I looked up the physiology, we found that it is thyroid that becomes active at the age of 13, the time when the menses start. And it is one hormone that is responsible for your overall growth. We all know about it. It is responsible for the physical, mental, intellectual being and even the sexual maturity also. And it is the one which actually stimulates the menstrual cycle. First, after giving the constitutional remedy which I was actually habituated to, I started her on thyroidinum. Now this was a big eye opener, because after giving thyroidinum, the menses which had stopped for maybe few months, she got her first sensation immediately on the second or the third day. She started menstruating normally. We continued on this remedy for a long time, intermixing it with the constitutional remedy whenever indicated. And then things changed. She started growing and the milestones also started becoming slightly better. This was a very important and learning case as the role of Sarcodes in homeopathy. We have many Sarcodes and we all know how Sarcodes are prepared and how they are used. But now we have a whole series of Sarcode remedies that we use very often, especially in gynecological conditions. Cases like PCOS, where you have lot of estrogen, progesterone, testosterone imbalance. These remedies have a huge role in homeopathy. We would be discussing this in our future courses. But today, since I remembered, I thought that I should share there is a huge role of Sarcodes in our cases, especially the endocrinal ones.